Locomotor diseases in sows. The diseases are osteochondrosis and OCD, epiphysiolysis, and osteoporosis. For osteochondrosis, the cause is multifactorial. It occurs when there's decreased blood vessels supporting growing cartilage. It can be due to genetics or rapid growth. The closing of the growth plate depends on the age, not the weight, and nutrition. The predisposing factors are rapid weight gain, ad libitum feeding in gilts and early breeding, and breeding and transportation strain. For the pathogenesis, when there's an endochondral ossification disturbance, the cartilage remains in the bone. The disease is usually affecting multiple joints and it's symmetrical. And for the lesions, we can see them on the growth plates and the articular epiphyseal cartilage complex. For the clinical signs, it can remain unnoticed, but it's usually in young sows, around 4 to 18 months, and fattening pigs and rapidly growing breeds. The signs are a lameness on multiple limbs and it's symmetrical. They're usually in a dog-like sitting posture. For the treatment, in sows it's not economical to treat, and in boars you give rest and meloxicam. For osteochondrosis dissecans, also known as OCD, this occurs in young breeding gilts, and it occurs at the distal end of the humerus and the femur. For the pathogenesis, it's when there's no blood supply to the epiphyseal cartilage. For the clinical signs, we can see lameness, and for the treatment, you cull the animals, and if they're valuable, you use NSAIDs. For osteochondrosis epiphysiolysis, the pathogenesis, it's unknown. It usually occurs in fattening pigs and gilts on the femur head. And in sows, it occurs on the tuber ischiaticum. The signs are sudden lameness, and the treatment is culling. For osteoporosis, this occurs when there's a calcium, phosphorus, or vitamin D deficiency, as well as an energy or protein deficiency. During lactation, PTH increases, and this causes calcium mobilization from the bones. In sows, it occurs at the end of lactation and at weaning, and in gilts, it occurs during the first lactation. The clinical signs are sudden severe lameness and fractures. In the pathophysiology, we can see a femur neck fracture. So you should look at the cortical thickness of the 6th rib. You do a transverse cut and you see if the surface area is less than 0.2. And to prevent this problem from happening in future, you need to supplement calcium and phosphorus and energy.